Morning. Morning, Ms. Majalamba.
Morning, Chair.
Morning. I just want to check my share screen to make me. Oh, I am a co-host. Okay.
Yes.
I just want to check it beforehand. Share screen. Where did I have it? BC on Health. This one. Is it not? There we go. Do you see the budget review report?
Yes, Chair.
Okay. I think I'll just switch off my camera and then leave it where it is.
Okay. All right, Chair. Okay, Chair.
The agenda, I'll just read the agenda and then I'll do this. Tell me quickly, it's only us as the portfolio committee, the department is not invited, right?
Yes, Chair.
Okay. Thank you.
Thank you, Chair.
All right.
Recording in progress.
Morning, everyone, and welcome to our meeting. This is a meeting of the Portfolio Committee on Health on the 18th of October. It's 10 o'clock in the morning, and we are about to receive the budget, the BRRR, or the and adoption for consideration of our committee and for adoption of this report by this committee this morning. Before I continue, I'd like to get an indication of apologies and attendance, Ms. Majalamba.
Good morning and thank you, Chair. Present is Dr. Jacobs, Ms. Gela, Mr. Howard, Mr. Kaba, Mr. Damini, Ms. Hicklin, Dr. Tembe Kwayo, and Mr. Van Staden. I've received an apology from Uma Musengo. Thank you.
Thank you very much. Members, before we continue, I'd like to remind you that this is a virtual meeting, which is deemed to be in the precinct of Parliament and therefore constitutes a meeting of a committee of the National Assembly for official purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges which apply in a sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which is an option that allows a member to put up his or her hand to raise points of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. When using the virtual system, members are urged to refrain or desist from unnecessary points of order or interjection. So, honorable members, we've had the department and its entities present their annual reports to us last week. We do fully understand that there are programs of Parliament which are determined according to what is required of us to do. And that based on those programs, we fulfill our mandates, we do the work that is required of us to do. And so we went through the process last week. We had a wonderful meetings last week. We had good presentations. We had good responses by the members, and we had good answers provided to the many different points which were raised by the members, by the department, and by the entities. Step where we will have to adopt the report, as I had mentioned earlier. And then after that, we are still going to adopt some minutes. We have 3 sets of minutes, which was compiled by the Secretariat. And we should be very thankful that they're able to do all this work in such a short space of time. So we must be mindful of the time that was needed for us to be able to complete this program. Also, just on the report, we must also remind that we finished on Friday last week. We are able to sit on this Wednesday morning. And for that also, we need to be very thankful to the staff, to Ms. Majalamba and Ms. Lumane, the 2 researchers, and everyone else who assists to bring this report to us. So, bearing that in mind, it is then asked of you to really be kind and be indulgent on the process, because we received the presentation yesterday. I hope all of you would have had an opportunity to go through the report, and that I'm going to now present this report to the committee. I've highlighted some of these points, so I'm going to go through this very rapidly, and I'll go mostly to the highlighted areas. It's a 71-page report, and then from page 57 onwards, which would be our observations and our conclusions and recommendations, we will spend a bit more time on that. So I'm going to start screen sharing, and we will go through this report. I'm going to switch off my camera now, and we will, I guess I must first switch off my camera now. I'll just stop this quickly. Stop sharing. Wow, what happened to my document? Just give me a moment. There we go. Do you see it, honorable members? No, you can't. I haven't shared. There we go. Are you able to see that?
Yes, Chair.
Thank you. So this is the budgetary review and recommendations report of the Portfolio Committee on Health on the performance of the National Department of Health and its entities 2022-2023, dated 18 October 2023. This is just what we've been doing for the past number of years. It gives you an idea of the contents, which is introduction, strategic overview, etc. Report of the FSC, report of the Auditor General, performance of the department, performance of the entities, and then, as I said, from page 57 onwards, committee observations and findings, committee recommendations and conclusion. I'm not going to do all of these, which we normally do. Just one, just a correction there. I think the word by must go out. If one reads the sentence, as Major Lambert to note. Then I'm not going to read through the departments. I'm not going to read through the policy priorities and alignment of the NDP to the NDP, the MTSF, the SONA 2022, and the SDGs. This we do every time, and I would hope that all members would have read through this. So let's look at just the parts which have highlighted department's plan policy initiatives 2022-2023. The plan policy priorities of the department during the period under review included the COVID-19 response plan, to mitigate the effects of the virus in South Africa, and focus was placed on increasing the COVID-19 vaccine population coverage, prevent further decline in the routine services. Due to the pandemic, there has been a decline in the routine services, and respective outcomes include, amongst others, case finding, detection in TB, expanded program on immunization, which have declined, and some decline in wellness testing, including diabetes. And to facilitate the implementation of the proposed national health insurance, the department aims to continue in its trajectory to prepare for the implementation of the proposed NHI, improvement of health system infrastructure. The department aims to focus on the refurbishment, upgrading, and building of new hospitals, health centers, clinics, and new specialized units, including oncology, which, according to the department, has improved over the recent years due to public-private partnerships. On the report of the FFC, of note are the following things. The health budget is expected to decrease from 64.5 billion rand to 60.1 billion rand in 2023-2024. It raises concerns in respect of the quality of public health care, considering existing backlogs exacerbated by COVID-19. They also note that the debt costs, just give me a moment, debt costs are increasing and crowding expenditure on critical social services, such as healthcare. There's an increase in expenditure in settling medical legal claims. The FFC recommended that greater focus is needed to improve the spending performance against certain conditional grants. The AGSA reported, and this is the report of the AGSA, that the audit outcomes of the health portfolio improved, mainly due to the NDOH's improved audit outcomes from qualified opinion to unqualified with findings. The SAMRC, CCOD, and OHSC obtained clean orders during the period under review, while the CMS, SAPRA, and NHLS obtained unqualified audit opinions with findings. AG identified material findings on annual performance, reporting, and achievement of targets by the NDOH and SAPRA. SAPRA has regressed in this area, and there are no material findings noted in the prior years. The SAMRC, OHSC, CMS, and NHLS did not have material findings on actual performance reporting. AG indicated that financial statements preparation remains a concern, as material adjustments were effected to annual financial statements submitted for audit by the NDOH, SAPRA, and NHLS. There were also a number of financial statement items which needed to be materially adjusted of the NHLS. On compliance to key legislation, AG indicated NDOH's findings on expenditure management, SAPRA on revenue management. The AG, though, commended the health portfolio on having addressed previous findings on procurement and contract management. Irregular expenditure increased from 4.5 billion rand in 2021 to 5.2 billion rand in 2022. Main contributors to the irregular expenditure were the NHLS incurring 4 billion rand, followed by the NDOH and CMS. Only 3 in terms of the provinces, 3 of the 10 departments received a qualification. Remember the Limpopo's audit outcomes have not been finalized by the legislated date of 31 July 2023. And there was no improvement to the audit outcomes of the Eastern Cape, Free State and Northern Cape, as they remain qualified for 4 consecutive years. These provinces therefore remaining a major concern. As you noted, the overall quality of annual financial statements for Gauteng, Mpumalanga, and Northwest is concerning, as numerous material misstatements were identified that requires correction on an annual basis. The AG commended the Western Cape and KwaZulu-Natal for producing good quality financial statements. Irregular expenditure has decreased from 9.5 billion rand in 2021 to 7 billion rand in 2022-2023. Main contributors to irregular expenditure were KwaZulu-Natal, Gauteng, Northern Cape and Northwest. Then the AG had concentrated on 3 aspects, and on those 3 aspects they had done the investigations, studies. And I'm only going to mention the 3 because we had discussed this at length. The idle clinic realization and maintenance program, the medical legal claims and infrastructure audit. Now all of these we will be having a look at later in terms of our findings and recommendations later in the report. So in terms of the performance of the Department of Health, under financial performance, the primary, we note that there was an underspending, and the primary causes of underspending in the budget are as follows: on goods and services, capital assets, and in relation to the National Health Insurance indirect grant. Again, I'm not going to go through all of that. And then on compensation of employees, it amounted to 760.9 million rand, which is 93.7% of the COE budget allocation of 812.5 million rand. On non-financial service delivery performance, you see the columns there, it's all highlighted. Just few items under program 1, which is administration. Program achieved only 1, which is 14.3% of the 7 planned targets of 2022-2023. Under program 2, which is the National Health Insurance, 1 out of the 4 planned targets, the department achieved 3, which is 75%, up from 40% in the previous financial year. On program 3, communicable and non-communicable diseases, in program 3, the department only achieved 11 out of 21, which is at 52.4% of the targets. And noting that none of the tuberculosis-related targets were achieved. And on primary healthcare, program 4, program consists of district health services, environmental and port health services, and emergency services and trauma. In terms of performance, 6 out of 7 targets, 85.7% were fully achieved. On program 5, hospital systems, 100% of the health facilities infrastructure management targets were achieved. There are the numbers. And on program 6, healthcare, health system governance and human resources, 7 of the 9 targets, 77.8% were fully achieved. It included 9 public nursing colleges being supported to achieve accreditation for basic and specialist nursing and with midwifery programs. 2 boards appointment recommendation made prior to expiry of their term, which is the SAMRC and the OHSC, and performance dashboards for national, provincial, and district levels will be developed and revised research priorities. Targets not achieved were as on the ideal clinics. 8 of the provinces supported to develop implementation plans for strengthening clinical governance, and community service policy review not published. And then the alpha version of network TB, HIV, plus information not developed pending an internal review of information systems processes. On human resources, overall vacancy rate of 23.8%, highest vacancy rates experienced at level 14. Well, let's start with level 13, which is at 19.3%, level 14 at 38.2%, and level 15 at 20%. It means that nearly a quarter of senior management positions are vacant, and the findings of the Auditor General on the department's audit outcome improved. Financial statements submitted for audit have not been prepared in accordance with the prescribed financial reporting framework and supported by full and proper records. This is a repeat finding. Material misstatements were identified by the auditors and were subsequently corrected. Then the AG had mentioned their findings on the reliability of information and on the different programs. In terms of performance of the entities, now this section provides an overview of the financial performance of the entities for the 2022 to 2023 financial year. And I'm going to again just highlight on SAPRA. SAPRA achieved 17 out of the 27 planned targets, which is 63%, and there's a decline as compared to 72% in 2021-2022. And the expenditure was 373.8 million rand against a budget of 349.4 million rand, meaning that they had a surplus towards the end of the financial year, which totaled 22.5 million rand as compared to an adjusted surplus of 22 million rand in 2021-2022. You have the statement of financial performance in the table before you. Then on the report of the Auditor General on SAPRA, SAPRA obtained an unqualified audit opinion with findings. AG identified material misstatements in the annual performance report submitted for auditing. Material findings on the reported performance information were identified under Program 2, which is Health Products Authorization. And the AGSA identified significant internal control deficiencies that resulted in the material findings. And on revenue management, the AG reported that effective and appropriate steps were not taken to collect all revenue due. On the Office of Health Standard Compliance, so overall the OHSC had achieved 23 output indicator targets for the 2022-2023 financial year, of which 65% were achieved. And in terms of Program 1, 75%, meaning 6 out of the 8 targets of Program 1 were fully achieved. Also to note that there was an overspend by 12 million rand. Program 2 had regressed in its performance against set targets from achieving 75% in 2021-2022 to 40% in 2022-2023. In terms of financial performance, they had overspent by 17.4 million rand. And then in terms of complaints management and Office of the Health Ombud, which is included here under Program 3, there was no improvement in performance under Program 3 during the period under review. Similar to the previous financial year, only one of the 5 targets was fully achieved. And the reasons cited were historic backlog cases, staffing constraints, delays, and lack of responses from health establishment and complainants for requested information. Program 4, Health Standards Design, Analysis, and Support. All the targets in this program were fully achieved. Program 5, Certification and Environment, and 3 planned targets, all 3 were achieved. And on financial performance, there you again have the columns on the financial performance. The total revenue generated increased by 2%, and the expenditure of the OHSC increased from 152.2 million rand to 2021-2022 to 191.7 million rand in 2022-2023, which represents an increase of 21%. The compliance inspectorate program's expenditure was the highest at 40%, and it is largely due to increased travel expenditure as well as the use of additional staff to conduct inspections. And then the report of the Auditor General, they received an unqualified audit opinion with no findings. The Office of the Health Ombud, they have different programs. We went through history and pattern of complaints, overview of the OHO's performance, complaints management. Then there was a lot of discussion on the human capital sub-program and complaints call center. So guys, in terms, this one I thought was significant is in terms of case patterns, that the number of people utilizing the complaints call center and assessment unit has grown steadily over the past 6 years. The complaints assessment unit has been under-resourced. It had 12 backlog complaints at the beginning of 2022-23. The unit managed to resolve all 12 complaints and closed the financial year with no backlog complaints for the first time since 2018. It resolved 57 newly assigned complaints, of which 40 were resolved within 30 days of receiving feedback from the complainant and or health establishment. Outstanding issues, one was the OHO bill and the separation of OHO from the OHSC. The other one was on the backlog cases, which we mentioned were addressed, in fact in this case to be addressed because there are staffing shortages, budget restrictions, and the governance of the OHO needs to be prioritized. And to create, and through creation of a professional career track or path for the persons who work for the OHO, since there is an absence of an organogram and a secure budget, and it's important therefore to create a career structure for the staff. On the SAMRC highlights, that raised more than 500 million rand together with the National Department of Science and Innovation to support more than 50 driven research, more than the 50 driven research projects. Initiated the Sisonke heterologous mRNA 1273 boost after prime with AD26.COVID2. Convene a consortium of development partners known as African mRNA Vaccine Consortium. And they have partners internationally, and they are mentioned there, and established an mRNA technology transfer hub in 2021. Commenced manufacturing capacity development program with the Chan Soon Shiong Family Foundation in the 2022-2023 financial year on financial performance. Slightly higher revenue of 1.270 billion rand in 2022-2023. Operating deficit, though, which shows 34.3 million rand during the period under review, while the investment income increased from 42.5 million rand in 2022-2023 up from 25.7 million rand in 2021-2022. By the end of March 2023, the surplus had increased from 6 million rand in 2021 to 7.5 million rand. The total assets in terms of their balance sheet, total assets leaped from 1 billion rand the previous financial year to 1.2 billion rand by end of March 2023. Conversely, the total liabilities stood at 737.5 million rand, which is a slight increase from 634.9 million rand documented in the preceding financial year. Importantly and notable, the accumulated surplus increased by 8 million rand from 426.7 million rand in the preceding reporting period to 434.3 million rand by end of March 2023. In terms of the report of the Auditor General, gave the entity a clean audit, become a norm for the SAMRC over the years. AG did not identify any significant deficiencies with respect to internal controls, and the AG had selected 2 programs, which are programs 2 and 3, and did not identify any significant deficiencies in internal control. In terms of the NHLS had some highlights which have been reported in the period under review. They had significantly decreased the creditors' days to 34 days, generated a surplus, maintained an unqualified audit report, published 664 articles in peer-reviewed journals, increased its total assets quite significantly by just under 3 billion rand, decreased its current liabilities from a restated 2.2 billion rand to 1.9 billion rand, and recalculated the provision for doubtful debt in line with the new accounting framework, collected 10 billion rand from provincial departments compared to 10.8 billion rand in the previous year, increased the count of test volumes administered from 106 million in 2022 to 110 million in the 2023 financial year, and NICD continued to play a pivotal role in ensuring swift interventions regarding communicable disease outbreaks such as cholera, typhoid fever, and measles in South Africa. In terms of Program 2, Academic Affairs, Research and Quality Assurance, they achieved 7 out of the 11 targets. And Program 3, Surveillance of Communicable Diseases. This is one of the entity's programs that achieved 100% of its performance targets. Program 4, Occupational and Environmental Health and Safety. The overall performance success rate for Program 4 was 100%. In terms of Program 5, Forensic Chemistry Laboratories, this program has been effectively integrated into the NHLS by April 2023. And on Program 6, Administration, in 2021-22 reporting period, program overspent by 1.77 billion rand, while in 2022-2023 financial year, it underspent by 1.47 billion rand. In terms of financial performance, again, you have the table. And as a highlight, by the end of March 2023, in terms of its total assets, which were 10.5 billion rand, which reflects a jump from 7.8 billion rand in the previous financial year. The total liabilities decreased from 3.2 billion rand in the preceding financial year or fiscal year to 2.7 billion rand in 2022-2023. There was an independent audit done by next year SAB&T, and even with this independent audit, the NHLS received an unqualified audit opinion that incurred irregular expenditure amounting to 705 million rand for the reporting period. An amount of 3.9 billion rand was declared impaired due to unrecoverable debt. In 2021-22, an amount of 4.7 billion rand was also impaired for the same reasons. And annual financial statements submitted for auditing were not prepared in accordance with the prescribed financial reporting framework. Material misstatements of non-current assets, current assets, liabilities, and other income, expenditure, and disclosure items identified by the auditors in the submitted financial statement were corrected, and the supporting records were provided, subsequently resulting in the financial statements receiving an unqualified audit. For the Council of Medical Schemes, you will see also the highlights, and it's contained in a table for you in the programs of administration, strategy, performance, and risk, regulation, policy, research and monitoring, member protection. And just to note the following, that in the 2022-2023 financial year, there were 71 medical schemes, 32 administrators, 43 managed care organizations, 2,185 broker organizations, and 7,567 individual healthcare brokers. Just as a comparison, that in year 2000, there were 144 schemes, which are more than double what we have now, with which 97 were restricted schemes, 47 open schemes, and medical scheme membership was at 8.9 million beneficiaries. In terms of financial performance, total assets jumped from 37.2 million rand to 72.3, which is very significant, a growth of 161%, which is always wonderful to see. Total liabilities, unfortunately, also increased, which is not that big, from 35 million rand to 41.5 million rand. And the statement of financial performance, some key points are highlighted, including that the CMS had a surplus of 28.6 million rand, compared to a previous surplus of 24.1 million rand. CMS received a grant from the National Department of Health in amount of 6.3 million rand, which is only up by 0.1 million rand. And administrative expenses incurred from 26.2 million rand in the previous year to 27.3 million rand in this year. Staff costs also increased from 110.1 million rand in 2021-22 to 122.4 million rand in 2022-2023. In terms of the report of the Auditor General, the CMS had received an unqualified audit opinion with findings on compliance. AG did not raise any material findings on the usefulness and reliability of the performance information. AG made findings regarding the following compliance themes: expenditure management, consequence management, internal control deficiencies. And the AG also raised the issue of the CMS paying council members a daily rate instead of an hourly rate. This is a contravention of the National Treasury Circular on remuneration of council members. On the CCOD, the fund CCOD does not have a board, as it operates as a sub-program of the National Department of Health. It receives its allocation from the NDOH. In return, the NDOH provides oversight and highlights our achievements. Commence with reforms of its legislating act, which is the ODIMWA, ensured sufficient liquidity to meet short-term financial obligations, successfully collaborate with provinces, neighboring countries, finalized 6,693 claims compared to the previous year, which was 6,153, maintained a surplus position with an accumulated surplus of 2 billion rand. Achieve the majority of its set targets in the 2022-2023 annual performance plan, ensure that its current assets stood at 5.443 billion rand, which exceeds its liabilities by far, which is at 881.9 million rand. Ensured innovations in service delivery to the current and ex-mine workers in mines works. Maintained a comprehensive database with access to the different class action and social protection funds. Finalized an average of 557 claimants, monthly totaling 168.6 million rand. and adjudicated 10,212 certifications of Medical Bureau of Occupational Diseases certification committees. In terms of their overview of their performance, 6 of the 9 targets were achieved, which is a 66.6%. And in terms of financial performance, total income, total revenue amounting to 1.129 billion rand, which shows strong growth, and it's quite a significant growth. And on expenditure, the finance costs show a slight increase from 262.3 to 282.7 million rand this year as compared to the previous year. In terms of its balance sheet, total expenditure stood at 335.6 million rand, which is an increase in the surplus from 150.9 million rand in 2021 to 794 million rand in 2022-2023 reporting period. The current assets show a moderate increase from 5.15 billion rand to 5.4430 billion rand, and total liability decreases in the compared to the 2 years. Net assets and accumulated surplus increases. In terms of the report of the Auditor General, an unqualified audit with no findings obtained. Fund was not required to prepare a report of its performance against predetermined objectives by end of March 2023, as it was not a listed public entity in terms of the PFMA. AG did not identify any material non-compliance with the selected legislative requirements, and did not identify any significant deficiencies in internal controls. So, honorable members, that brings us to the next part. We're now at 10:40. I'm just wondering, since I have now been talking all the time, whether maybe we should just complete this, because the next part is our committee observations and findings, which is about 10 pages. I think I'll just continue. For the next section, I'll be reading all of it, because it's quite important for us to agree to what our observations and findings are, and also later to agree to what our recommendations are. Overall performance and reporting. We welcome the various entities we express concern about the rigor in meeting its set targets. I've mentioned this throughout all the explanations, and the worst performing program is program 1, which is administration, which achieved only 14% of its targets. Expenditure spending of the department decreased from 98.8% to 97.4% in this year as compared to the previous year. Audit outcomes, committee congratulated the Department of Health on improved audit outcomes by obtaining an unqualified audit opinion from a qualification in the 2021-2022 financial year. Committee, and I'm not going to read the committee every time, we applauded the SAMRC, CCOD, and OHSC in obtaining clean audits, commended the department and entities for addressing previous findings on procurement and contract management, appreciated the improvement in the health sector audit outcomes as 6 provincial health departments obtained unqualified audit outcomes, raised concern regarding the material findings on annual performance reporting and achievement of targets by the department and SAPRA. We were concerned about the material misstatements on annual financial statements submitted by the department, SAPRA, and NHLS, and the committee noted with concern the stagnation in audit outcomes in 3 provincial health departments namely Eastern Cape, Free State, and Northern Cape, as they remain qualified for 4 consecutive years. Financial management. The committee expressed major concern that the department underspent its allocated budget by nearly 1.7 billion rand. Served to concern that irregular expenditure incurred by the department as entities increase. The health sector continues to incur significant amount of irregular expenditure. The unauthorized expenditure flagged by the AG was a concern to the committee. And we indicated that this should result in disciplinary hearing cases and that there must be some level of investigation and consequences. And the committee further want to know what the department is doing to control the risk. Underspend spending of conditional grants amounting to 2.4 billion rand remains a concern, with Gauteng underspending by 1.1 billion rand. The committee noted with concern the underspending on the health facility revitalization grant amounting to 752.2 million rand. While health facilities are laden with infrastructure challenges, the committee want to know what the implication. And this is a sentence that I wanted to know. What are the implications of the 19%? We must just correct this expenditure accrual. What implications do the 90% expenditure accrual have on the financial capacity? That would be the word. That would be due. And of the department to optimize an appropriation of what the plan is for the department to address this. As some provincial departments have almost 50% accruals. This is a very serious thing which we've also picked up with some of our oversights, and this is something that we're quite serious about, that it needs to be addressed very urgently. The committee sought clarity on how the department is supporting the provinces in dealing with accruals. On service delivery and operations, TB program, the committee notes concern that none of the TB related targets were met. Want to know how the department is going to address this. Committee noted concern the poor data capturing of TB. Want to know what the reasons were. HIV/AIDS response commended for achieving 94, 76, 92 of the against the 95, 95, 95 targets. Committee want to know the regions in which youth zones have been expanded and what the interaction rate is versus improved impact regarding STIs and HIV infection rates in areas with youth zones. So clarity on the disparities in blood alcohol test backlogs between the 4 forensic laboratories in Pretoria, which is the backlog of 7,300. The backlog of 737. And in Johannesburg, 50,441, as compared to 0 backlogs in Durban and Cape Town. The committee noted with concern the rising statistics of cancer and sought clarity on cancer awareness programs the department was working on. The department further noted with concerns the long waiting list for oncology treatment. The committee notes the progress made in reducing maternal infant mortality. Concerns remain about challenges of maternal and infant mortality, especially as public health facilities and injuries that occur during birth, which is also shown by the litigation cases. Sought further information alleged closure of establishments for abandoned infants. Raised this as a serious concern as these children are then inclined to be dropped in unsafe areas or places. We request the department to clarify its role on the matter relating to underage pregnancies that result from rape and whether these are reported to police by public health officials. So clarity on the funding model for the national health insurance in light of the country's current economic environment. Primary health care facilities that have not reached ideal clinic status. Committee want to know what the focus strategy and plans are to close the gaps as part of preparing for the NHI and to improve the quality of health care services. The committee sought an update on the appointment of operational managers for PHC facilities. NPC flagged the department should undertake a skills audit to identify skills gaps and a number of medical professionals that need to be retrained. Committee sought clarity on whether the audit has been conducted and the outcomes thereof. Committee sought clarity on the progress made in strengthening the integration between health and social services as recommended by the NPC. Committee inquired about the country's capacity to locally produce vaccines, for instance, the polio vaccine. On the poor uptake of COVID-19 vaccine, committee sought the strategy the department employs to encourage people to get vaccinated and counter anti-vaccine messages and misinformation. Further, the committee want to know how many doses are going to be destroyed in the near future. The committee brought to the attention of the department reports of medicine stockouts at Pulanomi Academic Hospital due to delays from the medical board. The committee requested the department follow this competent-based challenge. The committee expressed concern over the challenges facing the Northern Cape Provincial Department of Health, including the non-implementation of its audit plan, so clarity on the causal factors report that is provided to the province. The committee informed the department that about its oversight to the Eastern Cape, where it found that the infrastructure is dilapidated, there are severe staff shortages. Want to know how the department is going to assist the province. The committee noted the recent census report on the population growth and the level of migrants, and wanted to know the projected impact on the quality of healthcare provision and the strategies that can enable the department to negate the impact of cost containment measures and the fiscal declines. On human resources for health, we want to know what the lessons the department had learned from COVID-19 experience. The issue of critical posts not filled on time is a concern, and that there's no intake of learnerships and interns. We want to know, and it is a concern, and want to know what the department is going to do to address this. On ICT, noted with concern the delays in the implementation of the National Health Digital Strategy, concern about the inadequate IT systems and cybersecurity strategies. We inquired about the extent of digital healthcare provision in South Africa, what it was and how this can be alleviate the demand and pressure in the healthcare system. The committee want to know what potential artificial intelligence has for the healthcare system and the plans for the department as in this regard. On medical legal claims, we observed that medical legal claims put the sector under immense pressure, resulting in increased accruals and late payments of suppliers. We note with concern that medical legal claims have increased to 67 billion rand. Committee noted the steps the department has taken in managing medical legal claims, such as development and implementation of the case management system. We requested further details and findings from the system, particularly from Gauteng, KwaZulu-Natal, Free State, Northwest, and Northern Cape. The committee sought clarity on the measures the department has taken to expedite the legislative process on medical legal claims. On the infrastructure audit conducted by the AG, the committee noted with concern that infrastructure management and provincial health departments remain a challenge, with findings on delays in the implementation of projects due to poor performance of contractors, cost implementations, and poor project quality. Committee want to know what capability the department has to project manage and monitor infrastructure development effectively. And the committee further wanted to know the interventions that have been taken on contracts that do not meet the required standards as per their service level agreement, and effective is the contract management for the department. Honorable members, I'm going to stop here for 5 minutes. It's been a long time that I've been talking consistently. So it is now 10:52. We'll be back at 10:57 so that I can continue with the rest of these pages. Thank you. Please don't switch off your devices. Honorable members, can you hear me? Can you hear me?
Yes, Chair.
Are we on? Thank you. So I'm going to commence. I'll give another minute or so to make sure everyone is here. And then we will commence from where I left off with the entities at 7.2.
Back, Chair. I'm here. Thank you.
Thank you.
I'm also
Thank you,
present.
Chair.
Thank you very much. So, in going to the entities, we will go through them one by one in terms of our findings. On SAPRA, we congratulated SAPRA for obtaining an unqualified audit outcome. We are, however, concerned about issues raised by the AG, such as material misstatements with regards to the percentage of medicine backlogs cleared and weaknesses in record keeping, and that the management did not ensure appropriate review and monitoring of compliance with revenue and debt management policies, which led to an ineffective calculation of revenue earned. The committee wants to know whether the difficulties when addressing these issues is raised by the AG. We noted with concern the regression in performance from 72% to 63% compared to the 2 years. And we noted with concern the high vacancy rate at the entity and its inability to attract and retain staff. And that S must go out, will be retained and not retained. And the committee wanted to know the implications of the high vacancy rate in the operations of the entity. And the committee sought clarity on South Africa's contribution towards the ARMA Treaty. On the OHSC, we commend the OHSC for obtaining a clean audit outcome. Noted with concern the entity's performance and noted that 35% of its targets were not achieved, a decline in the number of inspections conducted. Noted concern by the committee the severe staff shortages. Excuse me, we want to know if this was hampering the entity's performance and express the need to expedite the complaints. Management process. Most of the complaints were received from Gauteng province. Noticed the complaints. Committee want to know the reasons behind the high number of complaints at Gauteng. Again, my internet, they say, is a bit unstable. Committee want to know how the entity was going to ensure that all the facilities for the implementation of the NHI. Committee further sought a list of facilities that have been inspected in the 2022-23 financial year. And we wanted to know the financial, I think the word there that was financial implications. We have put in the word financial before the word implication of the labor unrest when how the entity plans to deal with these in the long term. On the OHO, committee was concerned about office space challenges faced by the Ombud, concerned that most complaints were from Gauteng province. We noted we were concerned about the high vacancy rate of the Ombud and want to know to what extent does this affect backlogs in cases and governance issues. Want to know what the Office of the Ombud can do to drastically reduce medical legal claims. Inquired about the profile of the complaints and the weakness they reflect on the healthcare system. I want to know the overall compliance and progress in the implementation of recommendations of investigations conducted by the Office 29. On the SAMRC, we congratulated SAMRC in maintaining its clean audit outcome. Noted the slow pace of transformation in the SAM transformation the past 4 years. The committee noted the entity has a diversity bias in senior management with more women, but slow disadvantage. Want to know what work the entity has done to strengthen the ability to respond to. Noted on the Indian College for Africans to 74%. We're concerned on the decline of colored Europeans. Currently, 9% want to know what the ideal district is colored, and the concerned it does not have scholarship allocation for the University of Free State, want to know why it was not part of the institutional recipients, wanted to know what the measures that are required to ensure a preventative healthcare system and research work the entity has conducted to advance a preventative healthcare system. We noted with concern the consumption of highly processed foods. We want to know what the mechanism to combat this was as it contributes to the high burden of disease. We want to know what the outcomes of various partnerships with African countries and whether SMRC leadership is of the entities ultimately playing a role in continent, noting the challenges faced by the continent, and we want to know what the projected impact of the possible cost containment measures and the budget decline, whether the entity impacted on negatively. On NHL, the NHLS for obtaining an unqualified audit opinion. Note with concern irregular and fruitless expenditure incurred by the entities highlighted by the AG. The committee further wanted to know what the plans were in addressing the AG's findings. Notice some of the key weaknesses of recurring findings for the AG, especially in the areas of quality financial statement, prevention of irregular, unauthorized, fruitless, and wasteful expenditure. We inquired about what constraints were affecting management and the board in resolving this outcome and how these are going to be addressed by the entity. The committee want to know what the plans were for the backlogs of the forensic chemistry laboratories. Committee sought details on the plans to improve the NHLS footprint in the Northern Cape and Free State. I want to know what the entity was doing to improve this. The committee noted with concern that the target to develop and implement POC plan was not met in the financial year. Committee inquired how are the feasibility and cost-benefit assessment strategies being implemented 2023-2024 in preparation for the rollout to the PCOT. Wanted how effective how effective the proposed corrective measures are towards improving the percentage of TB gene expert tests performed within 40 hours and other energy targets affected by the energy crisis. On the CMS, commended CMS obtaining an unqualified audit, expressed concerns not changed since 2019, concerned about the regular expenditure, lack of consequence management thereof, want to know what they were going to do to address this, want to know what the status of effective supply chain management interventions proposed in the annual report regarding the monitoring of compliance with applicable laws and regulations as well as related internal controls. We sought an update on the low-cost benefit options for low-income earners who cannot afford medical aids. The committee was concerned that some schemes have refused to pay the PMBs and that members had to pay these from their savings. The committee wanted to know which schemes were responsible for this and what's been done to address this. So clarity on the financial implications for the legal opinions, was concerned about the slow pace it takes the entity to resolve cases, so wanted to know the audit backlogs they have. Noted the trend in increased complaints received, adjudicated, want to know what the issues are, how they are being addressed to prevent recurrence, and reduce the number of complaints received as part of strengthening mechanism for protecting beneficiaries. Noted with concern the rising cost of medical aids, want to know what the entity was doing to curb these increases, want to know what the systemic findings, the SIU investigation, the progress with the implementation of recommendations, the factors that are affecting medical schemes amendment bill, what they are and how it's being responded to, what are the internal disciplinary process taking place as against employees for fraud and poor performance, know how the media engagements improved in the financial year in informing the public about their rights and other matters concerning medical schemes. Committee wanted to know what the timelines were regarding development of the organizational diagnostic review, aimed to thoroughly assess the capabilities, identify potential areas for improvement. We noted the 30.8 million rand surplus by the entity, want to know how it was going to be utilized and whether it will be to strengthen capacity challenges such as human resource capital and ICT developments and improve operations and strengthen internal controls in the current financial year. On the CCOD, We congratulated CCOD for obtaining a clean audit outcome. Want to know what the time frame, so the DMOA amendments to be brought forward. Welcome the progress made on the compensation claims management system. Noted the benefits of outreach activities conducted in the 5 districts in KZN. Want to know what the plans were to duplicate this in other provinces. Inquired on whether there is a memorandum of understanding between the CCOD and Minerals Council with regards to the council staff utilization of this fund. Noted that the entity inspected 121 mines, wanted to know what observation recommendations were made to the visited mines, inquired what the status of improving mining work conditions to improve health outcomes of workers and not increase the 1 billion rand paid by the Shiaviso Trust to eligible silicosis and TB claimants. So, honorable members, we will now go to our recommendations, which is another 10 pages. More or less 9 to 10 pages, and we have made recommendations to the National Department of Health and every single entity. So I will now go through those. To the National Department of Health, in terms of audit outcomes, is to strengthen oversight regarding financial performance reporting and compliance, as well as related internal controls in order to move to clean audit, present a turnaround report to the committee on a quarterly basis. Present to the committee a turnaround plan to ensure improved service delivery performance in relation to the financial performance in ensuring value for money. Assist provincial departments to strengthen financial management planning and internal controls to improve and maintain audit outcomes. Provide a detailed plan to the committee demonstrating how the department plans to assist Eastern Cape, Free State and Northern Cape to move from qualified audit outcomes. And the detailed plan should be presented to the committee on a quarterly basis. On financial management, improve the department's governance and operations in order to realize its developmental and constitutional obligations. The department should develop an agile reprioritization strategy to optimize conditional grant spending for the sector and a pipeline of projects which are ready for implementation. Ensure that the department adopts strategies to ensure improved spending on the health facility revitalization grant to ensure urgent refurbishment, upgrading, and construction of health facilities. Provide systems to assist provincial departments to develop internal controls and instruments to monitor and eliminate irregular, fruitless, and wasteful expenditure, reduce inefficiencies. Provide the committee with a quarterly report on consequence management arising from non-compliance to the requirements of the PFMA 1 of 1999, the department should improve its preparations, review of annual financial statements on service delivery, operations, and governance. Ensure that public health facilities are equipped and resourced to carry out cesarean sections and reducing maternal and mortality, birth injuries, as well as litigation. Provide a progress report to the committee on the implementation of the National Mental Health Policy and Strategic Plan. Ensure adequate and dedicated funding for the ideal clinical realization and maintenance program in preparation for the NHI. Develop a strategy of optimizing the compensation budget to fill posts in the healthcare system as the department underspend while human resources gap is significant in the health system. Ensure the funding of the OHSC and OHO is prioritized in order to bolster the staff complement, including the appointment of inspectors, and to ensure adequate office space. The department must ensure that the Office of the Health Ombudsman is finalized. On the challenge of transformation of the SMRC, the Minister should intervene in ensuring that the entity fast-tracks the full implementation of this transformation agenda, should support the provincial health departments to ensure improved infrastructure project management and the monitoring of infrastructure development, and present to the Committee on Cancer Awareness projects conducted quarterly. On information technology, ensure great investment and all partnerships improve ICT systems, cybersecurity, and the full implementation of the National Digital Health Strategy. Ensure consequence management on infrastructure projects identified as not meeting standards and recoup funds where appropriate, and it should also assess the quality of infrastructure projects quarterly. On the entities, in general, the entities should develop action plans to address the issues identified by the AG and provide the committee with a progress report quarterly. And just a few mentioned, for example, under SAPRA, devise strategies and mechanisms to attract and retain staff. Plans to address backlog should be devised, implemented under OHSC. Develop a digital strategy which increases the reach of the entity. The entity must further have an equitable approach to visit provinces. OHO undertake research how to harness and affiliate with digital libraries. Let this thing just go away here, and work with higher education institutions to increase its access to library services. SAMRC, scholarship allocation for colored recipients should be addressed. Develop a relationship with the University of Free State, which is an established health faculty, as part of the expansion pool of institutional recipients of SAMRC research grant. Develop indicators that reflect on the entity's work in the continent. Undertake research on strengthening a preventative healthcare system approach in South Africa under existing constraints, as this will contribute to decreasing the disease burden in the medium to long term under the NHLS. NHLS should ensure that annual financial statements submitted for audit are properly reviewed. To ensure compliance with the applicable accounting framework, put measures in place to prevent irregular expenditure, and the entity should strengthen its consequence management system. Under CMS, ensure that internal control measures are improved to prevent irregular expenditure and consequence management implemented. Ensure the strengthening of supply chain management processes for all procurement in line with relevant prescriptive laws and regulations. And the CMA should provide the committee with the following reports: the Section 59 Investigation Panel Report, SIU Investigation Report, and Progress Report on the matters relating to the conduct of financial institutions, a bill, which is the Coffee Bill, and the Financial Sector Regulation Act, which is the FSRA. On the CCOD, the entity is encouraged to maintain its internal controls relating to financial management, good governance in audits to sustain its audit outcomes. And in conclusion, unless otherwise indicated, the Department of Health should respond to the committee recommendations in 3 months from the day when the report is adopted by the House. The department and entities are to provide progress reports on all the recommendations on a quarterly basis. Thank you, honorable members. That brings us to the end of the presentation of this report. I'm going to stop sharing now so that I am able to see the Zoom platform, so that I'm able to take any hands. I am mindful that we are now at 11:15. We're going to take your input on the report, and we'll see how far we get so that we are able to also attend to the 3 sets of minutes. I don't see any hands being raised on the platform yet. Just give me a moment. So it's in the following order. It's Gela, Van Staden. Any other hands? Clark?
Please, Chair, recognize mine. I'm trying to raise it. Thank you.
Naba? Any other hands?
Yeah, Stumo Dlamini, Chair. I'm struggling with putting my hand up here.
Thank you, Dlamini. Others can come afterwards. So let me then take in that order. It's Gela, Van Staden, Clark, Kaba, Dlamini. Thank you.
Thank you very much, Chair. Greetings to you and also to my colleagues in the platform. Chair, the report is covering everything that was discussed last week in the PEC meeting, and the recommendation are in order, Chair. because it's what we put during the presentation from the entities. Beside to say, Chair, the only thing that we must do is to make sure that we monitor the progress, especially to the provinces that did not perform well in terms of spending. We need, Chair, to call them and make them to account why the allocation was not spent accordingly. But the report, it's a true reflection of what was discussed in our previous meeting. Thank you very much, Chair.
Good morning, Chairperson and members and staff members. Thank you for the report and the presentation this morning. Just please take note, Chairperson, that the Freedom Front Plus reserves our right to take this report to our caucus for debate and final decision on the matter. Thank you very much.
Chair,
Thank you.
forget to say, Chair, as African National Congress, we support the report as we have presented before us. Thank you very much, Chair.
Thank you, Chair. And
Hello, it's me. I think I was next on the list.
oh, okay,
Next, followed by Kaba, and then followed by Dlamini.
sure.
Thank you, Chairperson. I don't know why I'm not there and only in the background. I've put my video on, so I don't know what's happening. Anyway, just to go forward, Chair, thank you very much for the report. I think it was one hell of a report to put together in a very short space of time. Thank you to the staff for doing that. Chairperson, we also requested that, and our support member Gela, where we requested that the provinces that have not performed must come and account to the committee. There was also an array of questions I sent in for written reply, which I only got this morning, and some of those issues have not been inserted. Be that as it may, just to also say that we reserve our rights in terms of this report, and we will be taking this report to our caucus for debate. I thank you, Chairperson.
Thank you, Chair. Chair, let me also join other members to welcome the report and surely, Chair, support Honorable Gela, and upon as the ANC to second her that their report be approved. What was stated, and as you outlined it, has been our discussion and our recommendations, and we stand full in support of this report, Chair. As we await the other provinces who may have not performed well, that they come to account to the committee. The report, I second Honorable Gela that it be adopted. Thank you, Chair.
Chair, I hope it's me now, Mr. Dlamini, to appreciate and support the report that you have presented to this portfolio committee, and to run on the words that Ms. Gela and Mr. Kaba have just raised on the visits to or checking with the provinces that are presented to have not done quite well. I support that, and to say that the report that is presented by you, Chair, here fully gives a picture of where we are and where we want to go as this portfolio committee. And I support the report fully, Chair. Thanks very much. Thanks.
Tembekwayo.
Thank you, Chairperson. The EFF reserves its right on this report. Thus, the EFF caucus will guide us accordingly. Thank you.
Any other members? I'd like to hear the other members. Evelyn?
Thank you, Chair. I will just echo what Honourable Clark said. We will take it back to our caucus for review there. Thank you so much, Chair.
Honourable Gela, did you raise your hand again?
Yes, Chair, I've raised my hand again, Chairperson. Chair, I think we are noting with a consent what other members have just said, because the report was presented last week to us, and also you have just did that. And I move for the adoption of the agenda because we know that we must move on. We are servicing the citizens of South Africa. This report is very important to be approved, Chair, and then it's going to be tabled in the Parliament. So, Chair, I think we are moving, Chair. We are supporting the report as African National Congress. Thank you very much, Chair. I adopt the report as it is, Chair. I move for the adoption of the report.
Honourable Gela, let me just correct you earlier. You've corrected it. I think you first said move for adoption of the agenda. You then corrected subsequently saying you're moving for the adoption of the report. So I understand you correctly.
Yes, Chair. I move for the adoption of the report as being tabled by you, Chair.
Thank you. I see the hand of Honourable Dlamini again.
Yes, Chair, thanks. It is just to second Honorable Gela on the report being adopted. Thanks very much.
Thank you very much. I see Honourable Clark.
Thank you, Chairperson. It must be noted, though, although Honourable Gela is adopting the report on behalf of the ANC, other parties, including the DA, has said that they would want to first concur with their caucus in discussion before we commit to this report. Thank you.
Thank you, Honourable Van Staden.
Yes, Chairperson. I also just put on record echoed what Member Clark also said, but I've said earlier that I must first take this report to my caucus for final decision. Thank you.
Thank you, Honourable Tembekwayo.
Yes, Chair, I request
Yes, Chairperson. Tembekwayo. Chair, did you say about Tembekwayo?
Honourable
Hello?
Tembekwayo, please continue.
Yeah, I'm saying I repeat what I said to say the caucus will guide us accordingly. So we are not in support.
Thank you, Honourable Kaba.
Thank you, Chair. Chair, I rise to support Honorable Gela and Honorable Stumo upon the report being adopted. Thank you.
Thank you. I also support that this report be adopted with a few minor changes which I have noted, and it's just spelling mistakes. So with those amendments, and that secondly, I do note the members, following members, Clark, Staden, Eklund, and Tembekwayo, saying they want to take this report. They reserve their right. They want to take this report to the caucuses. I think that in this time now, that we then agree that this report be adopted and that those rights are reserved. And thank you very much, honourable members. We will then move to the next item. Ms. Majalamba, can you please indicate the minutes? Can you go to the minutes, please? First set of minutes. Let me just complete this. So, Ms. Majalamba, not to forget that this report be sent to the House for discussion, debate, and adoption at the House. Thank you. So this is the first set of minutes, honorable members. This was on the 10th of October 2022. We had the FSC's presentation, the AG's presentation. We also had SAPRA on that day. Please note on the first page whether you'd been in attendance. And the second page. And then on the third page, I hope you've had an opportunity to read what was written under in the minutes. I had an opportunity to, and I agree with what has been captured here. Anything else on that page? Any omissions? Anything you want to correct? Next page.
None, Chair.
Thank you. Next page. So we've now gone through those three. So this one is, last one is the SAPRA. Next page. And the following page. Thank you. Honorable members, I want to ask for anybody to move to adopt these minutes and then for somebody to second that movement. Thank you.
Move for the adoption of the minutes.
Thank you, Honorable Gela.
I rise to second, Chair. Thank you.
Thank you. Next set of minutes. These are the minutes of the 11th of October 2023, and we had the briefings from the OHSC, the OHO, the SAMRC, and the NHLS. Please note, look whether you've been captured correctly as being present on that page, and then we go to the next page. So this is the briefing by the OHSC. I have perused the minutes. I have sent a reply to the committee secretary. I agree with the minutes. Anybody picking up anything on these pages? This page here. If they want to speak. Thank you. Next page. Anything here? Fourth page, the SAMRC. Next page. Briefing by the NHLS. Nothing. Thank you, honorable members. Can I ask for somebody to move for adoption of these minutes? And the second.
Chair, I move for the adoption of the minutes. This is the true reflection of what was discussed in the meeting.
Thank you. Any seconder?
The Stumo Dlamini seconds.
Yes, Chair, I second Honorable Gela and Comrade Stumo and Honorable Stumo. Sorry.
Thank you. You second on the Honorable Gela.
And me, Chair.
Oh, that you so it was actually seconded by Honorable Dlamini. I didn't.
Yes.
Thank you. So this is the last set of minutes for today. So it's on the 12th of October. It was a briefing by the CMS and by the CCOD. See if you are marked as being present. Next page. Thank you. Next page. Next page. Okay, honorable members, any inputs here? Any seconder? Any mover and any seconder?
Chair, I move for the adoption of the minutes.
Thank you. And any
Chair,
second?
I second.
Just give me a minute. I'm just writing my notes. Thank you.
Yeah, I also support that.
Thank you very much. So, thank you very much for your participation, honorable members. We have done very well. Just before we close, a couple of things that we need to talk to. One is we're having the 3-line work on Thursday. Just a reminder from me as the chair, which is a physical meeting in the town hall, or the city hall. And then secondly, don't forget about the public hearings, which you had been emailed and the logistics of in Mpumalanga this weekend from the 20th to the 22nd of October. And then we have also received an invite from the Minister to the South African Primary Healthcare Conference 2023, which is running from the 14th to the 17th of November in East London. Just note that on the 17th, 18th, and 19th, if I'm correct, yes, should be those dates of November, we are having public hearings on the Tobacco Control Bill, for short. Maybe I should say the Tobacco Products and Electronic Services Delivery Tobacco Products and Electronic Delivery Systems Control Bill from the 17th, 18th, and 19th of November in the Western Cape. So please do indicate. I would think that we could learn quite a bit. We can contribute at this conference, but it is up to the members to decide or to see whether they're able to attend. And we would definitely not be able to attend on the last day. We will write the necessary letters to explain this to the Minister of Health. I think before we conclude, I don't think there's anything else I am leaving. Don't forget that week after also, the 28th and 29th, we will be doing the same public hearings in the Free State Province. And you've also been given clear indications from our committee secretary on these, and a support team which normally communicates with us. Honorable Clerk, is there anything you want to raise?
Yes, Chairperson, I want to raise the fact that we're having our public hearings on the 18th and 19th of November. I think that poses a huge problem for all of us, Chair, because it's a registration weekend that weekend. And from a political aspect, we would have to be working in our constituencies on that weekend. Thank you.
Thank you. Noted, Honorable Clerk. Committee Secretary and I will discuss, but thank you very much for that. Honorable Van Staden. Honorable Tembakwayo first. I'm looking at the platform. Tembakwayo and then Van Staden.
Thank you, Chairperson. I don't think the 18th, that weekend of the 18th, we have to go on any public hearings. I don't think so. Find another date and which is possible for all of us to go. Thank you. It's not possible.
Thank you. Honorable Van Staden.
Yes, Chairperson. Now, on that registration weekend issue in November, it's going to be problematic. I will also not be able to attend due to the registration weekend, so I will be in the constituency. Thank you.
Chair?
Thank you, Honorable Gela.
Yes, Chair, I think you have said that you are going to relook another day for public hearing. So I want to say that I support you, that you are going to look another date because...
Honorable Gela, that's not what I said. I didn't say we will relook another date. I am saying I will discuss with Ms. Majalamba and we will look at what is being raised here now. I definitely did not say
But we are asking you, Chairperson.
So you're asking, you suggesting.
We are asking you to relook for another day. That's a general thing that we are asking you, Chairperson. Please listen to us.
Next is Honorable Hitler.
Thank you so much, Chair. Yes, I just want to echo the colleagues that went before me, sir. If there is a way in which we could look at accommodating the public hearings on another weekend, I think it would facilitate it for all of us. I think it's creating, it's not only going to create a problem for the committee, I think it's going to create a problem for the people who would either like to register or like to be at the public hearings. I think either way, it's a lose-lose situation as opposed to creating a win-win situation, which would be preferable. Thank you so much, Chair.
Thank you, Honorable Kaba.
Thank you, Chair. Chair, I raise my hand to support your leadership as you will look into the matter as you outlined, and we remain ready, Chair. Thank you.
Thank you very much. So, honorable members, as I said, I will discuss with the committee secretary. We will look into all the other logistical issues, etc. But that's a discussion that I will have with the committee secretary, who would be fully aware of what the implications would be. Yeah, I'm talking from a parliament point of view, etc. I think apart from that now, we've come to the end of our meeting. I appreciate you all coming to interact with the report, and number two, to adopt the minutes. I think as a portfolio committee, we are doing very, very well. We are really progressing with the work that is set before us. And I think it's very exciting for us to move as we do. And that we are also mindful of the challenges which are raised by each other as we move forward. So thank you very much for coming. This meeting is then adjourned. Thank you.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Recording stopped.